Hello all, this is Dr. Alsup, and in this learning objective video we will be discussing the basics of the lower limb neurovasculature. So again, this will be an introduction and certain components of this will be returned to in more detail, such as specifically the innervation as we delve into those regions. But for now, let's talk basics of the arteries, veins, nerves, and of course lymphatics. And I always like to start with arteries because understanding these names will help with the veins as well. And similar to what we had in the upper limb, there is one major primary source to the lower limb, except for the gluteal region, so this back region here, and we'll talk about some of those in upcoming sessions, as well as the medial thigh. The medial thigh will be supplied by the obturator. But all the rest of the lower limb is going to be supplied by the femoral artery. And that femoral artery is going to be the continuation of the external iliac artery. So kind of past the inguinal ligament, the name changes from external iliac to femoral artery. And we will see it dominantly will supply it'll be a very large component of the femoral triangle, which we will discuss in another learning objective video. And that femoral artery will change its name throughout its length. But as the femoral artery, it, with its major branch, the deep artery of the thigh, will supply the majority of the muscles of the thigh, except for, of course, that medial thigh region as we discussed. The femoral artery will transition its name to the popliteal artery, right around the region of what's referred to as the adductor hiatus, which is located in the tendon of the adductor magnus muscle. So it's kind of the adductor magnus will allow protected passage of the femoral vasculature down to the more distal portions of the lower limb. The popliteal artery supplies structures associated with the knee joint, as you can kind of see right around here. So there will be numerous anastomoses around the knee, similar to what you have in most other joints. At the distal end of the popliteal fossa, there's going to be, that popliteal fossa is an important area in the posterior knee region. And here the popliteal artery will end by bifurcating into the anterior as well as the posterior tibial arteries. So let's talk a little bit more about those. These arteries will supply the rest of the lower limb, so the leg and the foot, and their basic positions are focused around that interosseous membrane, or that sheet-like connective tissue that connects the tibial and fibular bodies, or shafts. So the anterior tibial artery will be located anterior to the interosseous membrane. And so it makes sense that it will be supplying muscles of the anterior compartment of the leg. As this artery passes over the dorsal ankle, so kind of this region here, its name will change to the dorsalis pedis artery. The posterior tibial artery travels posterior to the interosseous membrane, so it's behind the interosseous membrane, and it, as well as its branches, will supply the posterior compartment of the leg as well as the lateral compartment. And about at the level of the calcaneus, or that large tarsal heel bone, the posterior tibial artery will end by bifurcating into the medial and lateral plantar arteries. And so it is the dorsalis pedis artery that we discussed here, and these medial and lateral plantar arteries that will have numerous branches. It will create anastomotic arcades and supply the foot. All right, now on to veins. Similar again to the upper limb, there are superficial and deep veins, but it is the deep veins that are typically the largest in the lower limb, unlike what we had with the upper limb. An important concept when discussing veins of the lower limbs is that all of these veins have valves. So valves are very important when we are talking the lower limb. So valves are those cusps of endothelium within the veins, which are really important in terms of guiding the directionality of blood flow proximally towards the heart. In this region, this blood flow is going against gravity, so these valves are very important. Okay, a little bit about the superficial veins. These are located in the subcutaneous tissue, and there are many, many superficial veins, but the two most prominent are the great and small saphenous veins. The great saphenous vein is the longest, and it is dominant in the medial portion of the medial leg. So you can kind of see it going this entire way. So it's very prominent in that medial region. And it's most accessible at the medial malleolus, so at that palpable portion, this right here, of the medial ankle. This great saphenous vein will drain into the femoral vein. The small saphenous vein is going to be associated with the posterior leg. So it's running in that superficial fascia of the posterior leg, and it will drain into the deeper popliteal vein. The superficial veins will consistently drain into the deep veins via what's referred to as perforating veins, and these are fairly prominent in the lower limb. And so these perforating veins will penetrate the deep fascia and also contain valves. So valves, 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 very important. Now, again, these veins are working against gravity. They have that deep fascia tightly surrounding the muscles to when contracting, help move the blood in the right direction. So again, in this region, we will have deep veins. These deep veins, similar to what we had in the upper limb, are often referred to as accompanying veins or vena comitantes, as they are going to travel in pairs around the arteries. So very, very closely associated with the arteries, often wrapped up very tightly in connective tissue. Now, occasionally, the great saphenous vein, and really any lower limb vein, can become varicose. And so this means dilated. This will affect the valve's ability to properly close, allows blood to flow inferiorly or in that wrong direction. Occasionally, a deep vein thrombosis, or DVT, can occur, typically caused by venous stasis or stagnation, and this can be due to a multitude of reasons, such as inactivity of the muscles or an insufficiency of that musculovenous pump. So what's making the veins or the blood within the veins move in the correct direction. A thrombus formed from a DVT may break away from the vein and make its way all the way to the pulmonary artery, causing obstruction of that pulmonary artery. This is referred to as a pulmonary embolism, which I know you are likely quite familiar with at this point, or a thromboembolism, which can be an emergent situation. But it's from these veins that the thrombus typically initially forms. Now on to the innervation of the lower limb. There are two main plexuses that will contribute to both the afferent and efferent innervation of the lower limb. The lumbar plexus plays the smaller, but I would argue not too small, role. And in terms of afferent and efferent innervation, it will innervate the anterior medial compartments of the thigh, in addition to cutaneous innervation in additional areas distally. And we'll get more into the cutaneous innervation in upcoming sessions. The sacral plexus is the major plexus in terms of the lower limb. It will innervate all other regions of the lower limb, so this includes the gluteal region, posterior thigh, and the distal limb. The prominent nerve from the sacral plexus is the sciatic nerve, which happens to be the largest nerve in the body. I always really enjoy watching students discover the sciatic nerve in dissection, as it is so impressive in size. There are postganglionic sympathetics that travel in branches of these plexuses. We need those sympathetics in order to serve roles in vasoconstriction and initiating secretion of sweat. So those sympathetics do make their way to the limbs, but the parasympathetics do not. Which makes sense when you think about the role parasympathetics play. That has very little to do with the limbs. Last but not least, let's discuss the lymphatics of the region. Again, similar to the upper limb, so common theme. There are a lot of similarities between the upper and the lower limbs. There are superficial and deep sets of lymph vessels. The superficial lymph tend to drain into what's referred to as the superficial inguinal lymph nodes, whereas the deep lymph vessels will drain into the deep inguinal lymph nodes. And those superficial inguinal lymph nodes tend to drain into the deep inguinal lymph nodes right around the region of the femoral triangle. All right, excellent. We have covered the basics of the neurovasculature and lymphatics of the lower limb. Much more to come here, but we want to start getting used to these terms and general locations. I thank you for your time and attention here, and as always, have a great rest of your day.